question is to the Minister for Health. Last sitting week, in question time, I warned about the closure of birthing services at Portland Hospital and the fears of expectant mums of having their baby on the side of the road because they couldn't make it to Warrnambool on time. One of the mums who contacted me raising these fears, Jessa from Portland, had her worst fears realised yesterday. She delivered on the side of the road. This can't continue. When will the state government reopen birthing services at the Portland Hospital?
Minister for Health.
Can I thank the member for South West for her question? And I think we can all agree that we're very glad to hear the reports that both mother and baby are doing pretty well in the safe care of the Warrnambool Hospital. And I'm sure we send all of our best wishes to her and the baby and their family. But as I did in fact deal with this particular issue when the House was convened in the last sitting week, since that time I've had the opportunity of actually visiting the Portland Hospital and discussing this very issue amongst a range of other issues with the leadership of both Portland and surrounding health services. This is a very, very significant issue to all of the expected families of the South West. And foremost amongst that is the issue of delivering those services safely and in a manner that can be endured safely in those services. And any suggestion that whether it's the Portland Health Service or indeed the other services in that region would ever compromise safety is not one that this government would support. There are, regrettably, a number of vacancies and unfilled...
Ask the Minister to resume his seat for a moment. On a point of order, the member for South West.
Point of order on relevance. Can you clarify what safe means?
Order through the chair. Order. So the member for Gembrook and the Minister for Police can leave the chamber for the period of 1 hour. The Minister for Health.
Thank you, Speaker. So the leadership, the management, the board, all the practitioners at the Portland District Health Service put first and foremost the safety and the well-being of their patients in that community. The inescapable truth is that there is a nationwide shortage, particularly when it comes to regional and rural Victoria, of midwives in our community, in our state and in our nation. It would not be responsible for that health service to deliver services that could compromise the well-being and safety of mothers and children. And if the clinical advice says it's not safe to do so, whilst they actively seek to recruit, that is advice that I am more than happy to take and back in the Portland District Health Service 100%. And I look forward to their commitment to me and to the people of the Portland and wider district of the South West to fill those vacancies as soon as they possibly can and return those important services in an appropriate and safe manner to the people of the Portland and wider South West.
Member for South West Coast on a supplementary question.
Last sitting week, the Premier said about country health, the fact that you are a long way from Melbourne does not mean you should have to settle for anything other than excellence. Can the Minister tell the young mums in Portland why the government's definition of excellence is for them to have the strong possibility of giving birth on the side of the road because the government shut local birthing services?
Minister for Health.
Can I thank the member for South West for her supplementary question. The member knows full well that she's seeking to politicise the current circumstances of the Portland and District Health Service midwifery shortage in a way for cheap political points. I think we should all resolve to back the Portland District Health Service in its efforts to recruit and to design and deliver world-class, whether you're in Portland, whether in Mildura, whether you're in East Gippsland, whether you're in the northwest of the state, or whether you're in the central business district, safe and world-class midwifery services. That's what Portland District Health is committed to. That's what this government is committed to, and I look forward to working with Portland District Health and all our regional health services to make sure that all Victorians, no matter where they are, have access to world-class midwifery services.